Are you super stressed about a test coming up, or thinking about your family and just stressing about their health, or feeling that feeling of nausea right before you're about to throw up? Now imagine feeling like that all the time, but with nothing that's causing that feeling of anxiety. That is probably what somebody with generalized anxiety disorder feels like. GAD affects about 18.1% of the US population, and that is pretty relevant to us because somebody we know might be suffering from GAD. I am somebody who suffers from GAD. So I hope that I am able to inform those who listen to this about the symptoms, diagnosis, and treatment of generalized anxiety disorder. The first main point that I'd like to discuss are the symptoms of GAD. Although feeling anxious in stressful situations is normal and honestly drives a lot of people to do better, the people who suffer from GAD actually significantly interfere with daily life. That is according to the National Institute of Mental Health, being at work, school, giving speeches, and so much more. The most prominent symptoms of GAD, according to Mayo Clinic, are extremely worrying about things out of proportion, overthinking plans and solutions to all possible worst case scenarios, difficulty handling uncertainty, being super indecisive about things because of worry of making the wrong decision, unable to set worry aside. So again, those are some of the very prominent mental symptoms. So let's talk about physical ones. That could include fatigue, trouble sleeping, muscle tension and aches, nausea, diarrhea, and irritable bowel syndrome. The symptoms of GAD may affect different people differently, right? So there's different age groups, some of them being children and teens. So with children and teens with GAD, a lot of the worry stems from being able to fit in, wanting to be as perfect that they can be, but not being that for themselves, seeking reassurance from those around them, striving for approval, that kind of thing. So now that we know the symptoms of GAD, let's talk a little bit about the treatment. The two main treatments might be psychotherapy and medication, and if not both of those too. So according to WebMD, let's talk about the medications. So there's two main ones. There's the preventative ones, and there's the ones that talk about the problem at hand. Those are antidepressants and benzodiazepines. So there's two of these again. The antidepressants work more so about firing neurotransmitters in the brain, while the benzos are sedatives that actually relieve the short-term anxiety that one feels. Another main sort of treatment for generalized anxiety disorder is psychotherapy. One of the most common psychotherapies is cognitive behavioral therapy, which actually reroutes the brain and thinking in a more positive manner. So at my therapy, my therapist recommended this ring. So breathing helps to relax the brain, right? Being able to take a step back and just breathe and ground yourself again. So that's what this ring is. I spin this chain as I breathe in and then breathe out again. So this has helped me to deal with anxiety. And there's a lot of different things like this that a lot of people use. So in conclusion, I hope that this was able to inform you about the symptoms and treatment of generalized anxiety disorder. And now with that being said, just because people who have GAD have it bad, that does not mean that those who don't have it but feel anxious don't either. So I hope that this was informative to you guys about learning about GAD. Thank you for listening, and take care of your mental health. Thank you.